The short scar lift. Arms and legs are being influenced by weight loss in 2025. Patients have historically lost weight for any number of reasons, but we're seeing that at a tremendous exponential rate associated with the use of the GLP-1s, the Ozempics, the Zepbounds, Mounjaros of the world. So as we see loose skin, oftentimes we think of a lift or a removal of skin that is needed in order to solve that problem. When we talk about arms, historically that has involved a scar that may extend all the way from the elbow to the armpit or even beyond. This is scary as a patient to trade one problem for another. In other words, loose hanging skin for perhaps an unsightly scar. And I've always said you can be the best plastic surgeon in the world and have meticulous technique when it comes to suturing, but arm scars are inherently not the best. The reason for that is if we could complete that excision and closure and not be subjected to any movement, the scar would be a fine, thin line. But that's not reality. We know that we have to use our hands and our upper extremities, our arms, for things like brushing our hair, brushing our teeth, eating, carrying out those activities of daily living. All of these movements create some strain on those scars, which can result in some minor to moderate widening, which results in an unfavorable appearance to those scars. The same can be said with a thigh lift. Fortunately, a solution exists for many patients, particularly with the amount of weight lost with use of the GLP-1s in that 15 to 20% of total body weight. This is typically 20, 30 pounds, as opposed to the massive weight loss patient, which is, approaching 100 pounds and beyond. So a short scar lift can be a surgery that confines the scar to the armpit. Now, we don't have the presence of any existable scarring on the arm, but rather it's all tucked in an area that's not visible 99% of the time. The same can be said for the thighs, where the scars can be hidden within the groin crease, where the leg meets the torso or the pelvic area, so just along the crease of the groin. And again, we now can avoid the visible presence of a scar. Understand they have limitations. These are for minimal or kind of minimal to moderate weight loss, where most of that loose skin may be closer to the armpit. And we see this all the time with just this area that hangs right next to the armpit. Perfect patient for a short scar technique. The further we get away from where we're placing that scar, the less benefit. So if we have loose skin that extends all the way down the thigh, for instance, maybe the short scar is not the answer. But again, for many, many patients experiencing weight loss with GLP-1s, short scar techniques very much are the answer, and available here at Hanz Aesthetic Plastic Surgery. Dr. Kevin Hanz, a board-certified plastic surgeon in Dallas, Texas. I've been in the aesthetic space for approximately 20 years, board certified over the last 15. We find our private practice location at the southern tip of Highland Park, where Highland Park meets that uptown corridor, conveniently located with a number of exciting, innovative technologies available to you as a patient here at Hanz Aesthetic Plastic Surgery. We encourage you, if these issues resonate with you, to reach out. The office can be reached at 214-908-3633. We're happy to set up an initial consultation and meet with you in the very near future.